And then Delia, if you want to go to the next slide. Awesome. Thank you all so much for joining today. For those of you who don't know me, my name is Sarah, and I support our menstrual health supplies workstream at RHSC. As you might know, today's webinar is our third in a series that we have been co-hosting with the African Coalition for Menstrual Health. And this third session will focus on advocacy and really getting into the nitty-gritty of what advocacy is, what does advocacy mean, and how can we incorporate advocacy into our efforts to expand access to menstrual health supplies? So before we get started today, we just have a couple of logistics we wanted to review with everyone. Andile, if you can take us to the next slide. So just to give everyone a quick sense of what to expect, we have 4 different speakers joining us today who are going to walk us through some of the details around what advocacy is, some tips for successful advocacy, and then a case study actually looking at advocacy efforts in Kenya. Next slide. If you are interested in following today's webinar in a different language, we do have Wordly, an AI translation software that will help facilitate that. To access Wordly, you can either click the link that I've just dropped into the chat, or you can scan the QR code that is on your screen right now. That will then take you to a login page, as you can see there in step 2. And once you click into that page, you can choose the language that you want to follow along in. And you can choose either to have that available through closed captions, so almost like subtitles on your screen, or you can plug in a different device, the headset, so that you can listen to those translation captions as well. We also encourage everybody to make use of the chat today. You should all have access to the chat. You're welcome to introduce yourselves there. You can put questions in there. You're welcome to engage with one another there. And then we do also have the Q&A box. So if you have questions for one of our speakers today, you can put that in the box, and we'll hold plenty of time at the end of the webinar for those questions. And then finally, before we get started, we also wanted to wish everyone a one-day belated Happy Menstrual Hygiene Day. I think this is a well-timed session to focus on advocacy and accelerating access to menstrual health supplies globally through advocacy and through joint advocacy efforts. So without further ado, we will jump into the content for today, and we can go to the next slide. Awesome. So for our opening remarks today, we have Diana Nelson. Diana is the Global Advocacy Director at Days for Girls International, and she also co-chairs RHSC's Menstrual Health Supplies Workstream. Diana, I'll hand it over to you.
Thanks, Sarah, and thank you everyone for being here. I think, as Sarah said, this is the perfect concluding webinar, I think, for International Menstrual Hygiene Day and month, because without advocacy, it's hard to advance things. So as Sarah said, this is our third and final webinar focusing on menstrual health supplies in Africa. The first one focused on standards and why they're needed. We want to ensure they're safe and effective quality products for those who menstruate, as well as a healthy competitive market for products, right? Then we talked about leveraging data, and we shared many resources were shared for that. So if you've not accessed those, go back to the webinar notes and look at those on the RHSC website, because there's many great resources there. And so that brings us to this final one, advocacy and action. And not only just doing advocacy, but what does it take to have effective advocacy? You know, as I was thinking about it, advocacy really matters. I thought it's kind of like our cell phones, right? We have our phones, we have the screens, we have the data, but unless that phone is charged, that battery is full, that phone is completely useless to us. And I feel like that's what advocacy does. We have the data, we have the resources now. And so now it's, how do we get that battery charged? How do we get that information in a digestible way to all the different audiences? Because advocacy leads the catalyst for change. It raises the awareness. It helps draw funding as we have the data showing the need that is there. It creates policies, it creates social change, which then leads to that change. It also helps share the voice of those who aren't at the tables that we sit at. We share their lived realities, what is happening, really helping others understand the reality of, and the significance of this problem. And so One of the things I think too about advocacy, just like our phone, we don't buy our phone and plug it in one time and it's done. It is every day, right? We are charging it, we're working on it, and we know the panic when our phone doesn't work. We should feel that same panic if our advocacy is not working, because advocacy is a long-term commitment. It's going back, it's to people time after time, helping give them the information they need to better understand why this is an important topic and that they need to discuss and find policies and funding for. And so, as you look at your phone in the future, I hope you're thinking about your advocacy. The advocacy is a long term commitment. It requires taking the data, taking the resources out there, and putting them together and presenting them in a way that can be a catalyst for change. And so, with that, today we're so excited that we're going to zoom in and learn what is the nitty gritty to have effective advocacy so that we can see change. So thank you so much for being here. And Sarah, I'll turn the time back over to you.
Awesome. Thank you so much, Diana. We can go to the next slide on delay. Excellent. So for our first session today in our Advocacy in Action webinar, we are going to hear from two different speakers in applying the SMART advocacy approach, which you'll hear more about, to menstrual health. And so I invite our speakers, Halima Sharif, who's an advocacy and communications professional, as well as Beth Frederick, the chair of RHSC's executive committee, who also has robust advocacy expertise. I invite the two of them to the floor, and the time is yours. And next slide on delay.
Thank you very much, everyone. Good afternoon, good morning to you all. We are excited to have you join this webinar. My name is Halima Sharif.
And I'm Beth Frederick. Halima and I have worked for over a decade to secure the political and financial support needed to ensure that all women and couples are able to use quality, accessible, affordable contraceptives and the contraceptives of their choice. And we think that it's very applicable to the menstrual health advocacy that you're hoping to do in the future and that many of you have probably already been working on.
Our work started with the very successful 14-year Advanced Family Planning Initiative that was actually implemented across several countries in Africa and Asia, and also part of Latin America. This SMART advocacy work is continuing right now through a new African-led effort, the SASA Alliance. Maybe some of you have heard about it, which stands for Smart Advocacy for Strategic Action. SASA works in 5 African countries around issues on maternal health and family planning to contribute towards building an advocacy ecosystem by strengthening advocacy capacity of local actors. As you know, the funding landscape globally has changed, and SASA believes this is one of the most important initiative right now.
So our session today focuses on the basics of smart advocacy. We imagine that many of you have come in contact with smart advocacy, but we think it can be very useful to the new and underused reproductive health technologies working group and the menstrual working group in particular. Next. So a lot of people are intimidated by advocacy and figuring out how they can dip their toe or their full leg or their full body into advocacy. But advocacy doesn't need to be intimidating. We're all born advocates, and if you think back to your own childhood, what tactics did you use to convince your parents to make your favorite food for dinner, to take you on a walk, to play with you? I imagine, like Halima and me, you knew the perfect way to persuade them. And to be successful, you learned what they cared about most and customized your advocacy to mom and dad based on what they cared about, that you had done your schoolwork, that you were ready to help with the cooking, or they loved it when you gave them a big hug. This is advocacy. Advocacy is no different. The most successful advocates know that the right decision makers value and craft arguments grounded on reliable evidence, data, and align that with what they feel is most important, what the decision maker feels is most important.
Next.
No.
So as Beth has laid out that ground, and Diana, picking from what she said, that advocacy is a long-term commitment, and indeed it is. So we all are aware, or we all know, SMART is an acronym that stands for specific, measurable, attainable, relevant, and time-bound. So the three phases, as you see in this slide, on smart advocacy approach focuses on achieving advocacy wins, those discrete, critical policy or funding decisions that must occur in a near term, like 6 to 12 months, in order to achieve a broader goal, to contribute towards that broader goal. The guiding principle is that advocacy is disciplined, is focused, and evidence-based, incremental approach. You build on those incremental results as you move on, with which to build the momentum and achieve success incrementally and eventually deliver results. So advocacy for all of us in this room never ends. Now, when you look at the first phase in a summary, it's about building consensus, and because advocacy is a collaborative process, advocates must understand the landscape. What is the evidence on issues that they are striving to change? We know that successful advocacy is anchored on smart advocacy objective or objectives that contribute towards impact. What is it that you want to accomplish? And what is your course of action? Bearing in mind that there will be challenges, there will be opposition that you are likely to encounter, while you also exploit existing opportunities so that you can propel your work. Advocacy thrives on strategic partners, and these include the media, partners that are endowed with expertise, networks, evidence, data, and they have access to decision makers. So together, advocacy thrives on strategic or advocacy. Together, you will need to continuously review and update the landscape assessment that you made initially to identify those opportunities that I'm talking about that will help your advocacy efforts, and especially in engaging your decision maker to act on an advocacy work, ask, as well as determine whether there has been any change in your key decision maker or change in the circumstances. So it's not rigid. You've got to go with the flow and make sure you are monitoring the landscape. Phase two quickly focuses on understanding your decision maker, the person who has the power to act on your objective. You want your advocacy effort to resonate with what they care about. What are their values, the possible interests? What are their objections to what you are asking them to do? Your advocacy ask is supposed to be specific. In other words, it is supposed to be smart. And for those who've done smart advocacy, it's in fact a repackage of your SMART objective. Determine who within your coalition or outside your circle could serve as a messenger, because a good messenger is critical. So you conceive the activities that lead to achieving your advocacy win, assign partners specific responsibilities, and have markers or to track progress. And you set indicators so that you can determine, are you successful in achieving your advocacy win, or you need to tweak your activities. As you develop your advocacy work plan, you must consider, what are those existing opportunities that will help me in my advocacy work? Like, when is it the right time for me to present my ask? Or is there any policy that is now undergoing some change? So this is the time to put my ask so that I get to my advocacy win. Phase three is really about packaging the materials, because advocacy is not just about talking, but having materials packaged with an ask that resonates with your key decision maker. And you've got to know your decision maker. Is he knowledgeable, he or she knowledgeable, or are they informed, or they don't care, or are they already champions of the issue that you're advancing? That helps you to package your ask, and that helps you to engage the decision maker more effectively. So your decision maker is likely to act on your ask if it is anchored on evidence, or is anchored on an emotional story, or you got to know whether a decision maker is ethical, so something around equity and rights and so forth. How would you present your case? Is it at a formal meeting, informal meeting? Who will do that in your circle? You know, the division of roles in your coalition, and how will you all follow up? Because advocacy produces results, you must continuously monitor the implementation of your work plan, determine if you need to refine your strategy, and document your progress. Monitoring, of course, will allow you to determine the advocacy wins and how you are moving towards the long-term gains. Again, documenting your outcomes, lessons, and challenges will enrich future arguments on the value of investing in those issues and therefore positively impact on people's lives, but also it will demonstrate the value of investing in advocacy. At the end, you may wish to tell your story via the media or different forums like a webinar like this. If we were to tell our AFP story, this would have been the perfect time. And then you proceed with advocacy efforts by developing new smart advocacy. Next.
Sarah? Okay, so this is a list of common missteps in advocacy, and I'm not going to read them all because I think most of you have encountered an advocacy effort or some place where you'd want to persuade someone and you realize that you're asking the wrong person, or that you're having an unclear objective. You're saying that you want menstrual health products to be available to everyone, but you don't have any concrete ask for the decision maker. You don't know the evidence, or you haven't prepared any evidence, or as Halima just said, any stories about deprivation with menstrual products, or with any sort of ethical arguments, like the disparity between young girls and young boys in education or other rights that they might have. Not building and sustaining relationships is huge, because this is all about developing a person's a relationship with a person in power that you can continue to build on. And it's important that you find out what they care about and why they're interested in your issue. And finally, not learning and improving, and ignoring larger trends. And larger trends are the things that we're dealing with right now, the funding cuts from all of the donor countries, and the importance of domestic resource mobilization and the strains on those funds. Next. And go forward, Sarah, please.
Okay, so now you have your strategy. You've been implementing it. So it's time to consider your next objective. The slide before you shows first and foremost how flexible the smart advocacy is, in the sense that you can turn around, pause, and rethink, regroup, and develop a new objective or tweak the old one. And then move on with your advocacy strategy. So because advocacy is a process, each advocacy win builds on the one before, the one before it, to make progress towards impact. At every step, from advocacy strategy formulation to advocacy implementation and evaluation, you will need to review and update the landscape assessment so that you remain relevant, you remain effective, and revise some of your activities at the implementation phase, for instance, to ensure that you are on track and that your advocacy efforts are certainly going to deliver desired results. Or in some cases, you revise your SMART objective just because the landscape has changed. You don't wait. You've got to be up to date with the changing environment, if the environment has changed. Or from your evaluation, you realize there's need to revise the agenda. Like you've taken increased funding for family planning or maternal health or menstrual health products, and you realize you've done so much, and this is actually not moving. It is a critical issue, but maybe the timing, the environment at that time is not getting you to move the way you wanted, you reset the agenda. Like you look at an issue that will definitely contribute to what you're trying to advocate for, but maybe not the same objective within those issues that you've identified. Nevertheless, you will always need to adapt your plan to new circumstances. Next.
Go to the next one, Sarah.
Delia, I think if you can go one more slide ahead.
Delay, just go one more forward. And I'm going to apologize right now that I'm fallible and that I sent the wrong PowerPoint. So it's all okay. It's all good. But we'd like to hear from you now. And in the chat, we hope that you will give us some sense of the kinds of decision makers that are important to menstrual health products and to the objectives that you might be that you have crafted yourself, because we know a lot of you have been exposed to smart advocacy and some of the opportunities you see in menstrual health in your countries or your context. So if you could put some of those things in the chat, we'd like to give you a few minutes to think about who the most approachable decision makers are, what the most achievable opportunities there are, and what kinds of evidence and arguments you might be using to make the case for menstrual health. So if somebody can time us, we're going to have 5 minutes or 3 minutes for this.
Sounds great. I will keep an eye on time.
Great. And we'll be looking at the chat ourselves. So what we're asking for are the type of decision makers who have authority over menstrual health, the public and private decision makers, for example, the achievable policy and funding opportunities, and any arguments for menstrual health. I'm not seeing anybody adding. Well, this might suggest that, here we go. Thank you, Adrian. This is fantastic. I love the idea of the tax authorities. We in the United States pay tax on, at least for a long time, we paid tax on menstrual products. Yeah, the chat is starting to heat up. It's great.
Just as a quick time check, we have about a minute left in our 3-minute brainstorm.
And you can keep adding to the chat while we conclude our remarks. Uh-huh. Diana, who has put in the Department of Education, I would encourage you to think about which person within the education department is the most important, or the education ministry, because you want to find the person who is accessible, not the Minister of Education for sure. One of the secrets of advanced family planning, while we wait for this to complete, is that we would find the smallest, most achievable first step that we could find in any of the areas where we were advocating, because that was the first step to a snowballing effect of getting more and more support and easier compliance with our requests. All right, let's go to the last slide, please. And if you have never had any exposure to smart advocacy, and you want to know the most important part, it is that it's this formula: who does what by when. And when we do this in formal trainings, we ask you to find the most accessible decision maker. That's the who. Name them and their professional designation. Does what? A specific thing, not support menstrual health products, for example, but to reduce the tax on women's products by 2%, and then by when? Within the next 6 months. You want something that you can do quickly, because what you want in your coalition is to have a sense of momentum and ease, that it's easy to come together and get a small victory that you can build on. And trust me when I say those small victories begin to add up as you build relationships and start seeing progress in your work. So the smallest things, even if you get the biggest pharmacy group in your town to start giving a coupon for menstrual health products, or reducing a little bit of the burden of cost, that's a big thing for the people that live in your community. So it doesn't hurt to start small and to think small. One of the things that people do all the time is try and focus on the Minister of Health, Education, or Commerce for their kind of the big wins. You'll never reach those people, and they truly don't actually make the decisions. It's all their staff that's making the decisions at the lower level. And there are many entry points if you're creative and you have a great coalition who can work on advocacy. And for those of you who have seen smart advocacy before, we apologize. And we hope you've learned a little bit more about how to present smart advocacy to your coalitions. And go to the last slide, please. This is how you can find a huge amount of smart advocacy resources at smartadvocacy.org, which is nested within the Hopkins Gates Institute. And I want to thank you on behalf of Halima and myself. And I want to apologize. It's my problem that I sent the wrong slide deck, and I will send the right one to Sarah. And if anyone wants it, this is how you can find if you want the presentation we've just given, because you could probably do it yourself, I would be happy to send you a better version. And thank you very much. Anything you want to say in closing, Halima?
No, Beth, thank you. Maybe if there'll be any questions, but I just wanted to emphasize on the monitoring and the landscape change, because sometimes we do advocacy and we probably close our ears and eyes to other coalitions or other organizations. They're probably doing what we are doing, and they've managed to change something, and we are still concerned about that and we pursue it, and then you're told but this other organization has done that. So it is always in smart advocacy, you want to be relevant. Otherwise, you'll knock at the doors of decision makers, then they'll say, where have you been? We've done that, it's embarrassing. Thank you, Beth.
And with that, we close.
Awesome. Thank you so much, Beth and Halima. An excellent presentation on smart advocacy, which is such a valuable resource. Please do check it out. Let us know if you have any questions. Beth and Halima have kindly put their contact info on the screen as well. So very happy to connect people around any questions about smart advocacy. With that, Andile, we can go to the next slide. And so as you continue to reflect on the smart advocacy presentation, if you have questions, do put them in the chat. We're going to move to the second presentation that we have, but then we will hold some time for questions at the end. For our second presentation, I'm very excited to introduce you to Neville Okwaro. Neville is a menstrual health and hygiene as well as a monitoring and evaluation professional and has robust experience working on menstrual health advocacy. And Neville's presentation today will focus on advocacy for menstrual product standards in Kenya. With that, Neville, I will invite you to come on screen and hand it over to you. And on delay, we can go to the next slide. Thank you so much.
Thank you so much for the introduction, and thank you also for this opportunity. I also want to say thank you to Beth and Halima for that wonderful presentation. And I love the first slide that they said, we are all advocates, yet maybe we might not be aware that you are all advocates. All of us believe we are doing just our little, something small in pushing the needle on matters menstrual health. So whatever I'm going to present is our experience with advocacy, and especially advocating for standards for washable pads in Kenya. Next. Starting it off, we were maybe just to look at the policy spark and how we came now to think about standards for menstrual products, especially the washable pads. In 2014, we had started the development of, or rather the advocacy towards development of the National Menstrual Health and Hygiene Policy. At that particular time, what gave us a push was there was also the development of the Kenya Sanitation and Hygiene Policy that was ongoing, that was later launched in 2016. And one of the recommendations that we had was to look at developing the National Menstrual Health and Hygiene Policy for Kenya. So based on that, we were asking ourselves, now how do we go about that? At that particular time also, reusable pads were basically gaining traction all over the country. And however much they were gaining traction, there were most of the products that were around were not quality products. So we also decided that we are going to develop standards, work together with the Kenya Bureau of Standards to develop standards for menstrual products. So these two processes were moving concurrently. And one thing that maybe is worth mentioning, that at this particular time, we had not seen the sense to merge these two particular processes. That is the development of the policy and also development of the standards. So the Ministry of Health was working closely with the Kenya Bureau of Standards which was taking lead in the development of standards. And several actors were also invited to the KEBS committee that was working on the standards. So it was not until 2018 that we realized there is need for us to look at policy recognition of washable pads that will also bolster the development of standards for reusable pads. And this was a request that was laid down by the Kenya Bureau of Standards, because they felt, how can we develop standards for something that is fairly new? We never knew that at one given point in life, people will be using, one of them called them clothes for managing menstruation. So how do we develop standards for these particular products? Next. So from that particular time, now we're at a loss. Whom are we going to talk to? But based on the experience that we had, however challenging it was, we realized one thing, that mapping of all the key actors is very key. And not just the key actors, but relevant key actors that are going to add value. At that particular time, we had approached the Kenya Bureau of Standards, Ministry of Health, Ministry of Education. We had Ministry of Gender. We also had representation from the Kenya Women Parliamentarians Association, just for the purposes of ensuring that we've gotten on the right track. Then secondly, we also realized that it's important to build bridges with technical departments, not just political offices. Um, uh, uh, the technical departments will be there. The minister and, for instance, the principal secretary are all political appointees. One of the things that we realize is it's actually important for us to anchor our work within these technical departments for the purposes of driving that process even after the political officers are not there. Then it's also important for us to have that technical voice. And in this, we had the Ministry of Health and also the Kenya Medical Association, which in essence is a trusted voice even within the country and within KEBS. We also learned you don't knock on every door, but you knock on the right doors. Because one of the notable things is that we will invite every Tom, Dick, and Harry for meetings, and we will even we had participant lists showing that we had these departments in this meeting, but these were not even decision makers, and these had no stake in what we do. So we learned that it is important to knock on the right doors. Then also, we also learned that in government, titles don't move processes. It's important for you to have a champion who is going to do that particular work, that is going to ensure that even within a particular department, everyone is in sync. Next. Entering the Kenya Bureau of Standards conversation, it's important for us, it was actually important for us to lay the clear linkages because they wanted to understand why should we do this. We had to lay a very clear linkage between health and policy and also public good because the products are already within the public. People are using them. But there's a likelihood that if we don't have safe and quality products, then eventually it might harm them. So we had to lay the linkage and how health policy and public good interlink. Then there was need for us to ensure that there is evidence. We collected whatever research that we could get our hands on, both researches done in Kenya and outside the country, just for the purposes of ensuring that government is on board when it comes to this. But also at the same time, we had to lay the urgency of that matter because the products are already out there. It's urgent that the Kenya Bureau of Standards had to lay, had to develop standards for these and also align them with some of the things that were happening in the country at that time. Then it's also important for a user-centered approach. There's nothing like one size fits it all. It's important to contextualize and also to look at the pathway that will bring recognition and also respect for user realities and different users in this sense. Then also at the same time, it was important for us to also, as we are looking at the user, to understand that we have different users. We have people with disabilities. How will they use these products with ease? Getting a seat at the table is hard. That I can attest. But keeping it and remaining relevant, that's now the real advocacy, which to me is very important. And also, standards is more of a political process, especially in my country. We have people with vested interests. We have people who may not even understand why we need that standard. And it's purely 90% of persistence and advocacy and 10% of paperwork. Because when I look at the time it took for us to get the standard vis-a-vis, all this time that years, 5 or 6 years that we were jumping from one office to another, I realized that advocacy and persistence is what gave us the standards. Then also, it's important to frame our advocacy. For instance, reusables lack regulation. It means users are not protected. So the solution then will be to develop a standard aligned with national health policy, leading to safe and dignified menstrual experience. So when we merged and linked the policy and the standards, we realized that the policy was able to open the door, but now standards gave it the lock and key, meaning we were able to lock out each and every product that was deemed to be of poor quality. Next. So part of the work that we've done before is lifting local manufacturers for them to understand the standard. Because you can regulate a market. But if by any chance no one meets the standard, then there's no one to regulate in the first place. So we identified, that was last year, we identified some manufacturers, and mainly they were community-based organizations. And we advised them on the need to have a business wing of their work. Then we provided training and capacity building, and this was mainly done by the Kenya Bureau of Standards, looking at standard interpretation, because once you have the standard, in most cases you look at it, you'll interpret it in your own different way. So we supported them also on pre-certification support and assessment, and through that, 7 out of the 15 organizations had their product certified. And that also meant that we had helped them to unlock, they are now able to sell to schools, to NGOs, and also to county governments. Next. So what are some of the key lessons that we learned? Policy and standards must talk to each other. That is given. Then also government champions will always turn ideas into action. Very important to have a champion within government who is able to move the discussion. Then don't leave manufacturers behind. As I said earlier, some of them do not even know that there is a standard. Some of them will have different and varied interpretation. Then consensus will take time, but that is what makes the standard to last. We also learned that regulation is a public health imperative. It is not luxury. And even while looking at regulation, we are not regulating to look at the usual enforcements that we had before, but looking at how do we lift most of these products so that we have safe and quality products. And lastly, always ask yourself, are we being inclusive enough? Is there someone that has been left behind? With that, I just want to say thank you for listening. Thank you so much.
Awesome. Thank you so much, Neville. This is such a tangible example of advocacy in action and work that you've done to apply a lot of the topics and ideas that Beth and Halima were just speaking about to a very tangible example in Kenya. So thank you so much for walking us through that and for sharing these lessons learned. For those on the line with us, we have about a little bit less than 15 minutes left in our webinar with plenty of time for Q&A. So if you do have any questions that you would like to ask to Neville, to Beth and Halima, or to Diana, please do put those in the chat. I will keep an eye on that to refer questions towards our panelists. But maybe while we're waiting for questions to come in, Diana, not to put you on the spot, but as our co-chair, I wanted to see if you had a question for any of our speakers today that you wanted to put forward. So over to you, Diana.
Yeah, thank you. And first, thank you, Neville and everyone. What excellent presentations. I really like the actual tangible one, Neville, of you digging into standards, which is actually my question. As Neville's aware, and many people on this at this webinar, we're all working for ISO TC 338, right? We've been advocating for it. And so maybe Neville, if you don't mind, I might direct this to you. I think we're doing a great job of bringing different countries on board. But what I want to know from your lens, having done this in Kenya, advocated, what strategies or suggestions might you have that we can ensure once ISO TC 338 is published, that we can get governments to take it up and actually use it? That's one of the things we're working on now in our communication, but I'd love to hear any suggestions, Neville, you have to ensure that once it's published, it's being used.
Thank you so much for that. For me, maybe what I can say is it's actually important. It's actually important for the work to start early, way before even the standards are finalized. It's important for governments to understand the importance of this particular work and what it means. Looking at also the work that has been done in developing the ISO standards, if by any chance, even as a country, we had that years back, I believe it would not have taken that long, because one of the things that happened in, maybe, let me say, Africa, Kenya by extension, is they will normally trust things like ISO standards. And it's important for them to know that there is a process ongoing, that there is something that will come out in the long run. And when this comes out, what does it mean to them? And what is it that you will want them to do? So governments will always work when there is a clear communication on, this is what we have, this is what we want to do, and this is how you come in. So I would just propose that start that advocacy early enough, even before the standards are out.
Oh, do you mind, Neville? Thank you so much for that, because I actually agree. For those who may have not been in the room who are on this call when we were in Kenya, it was very interesting. Ken from the KEBS in Kenya, the Bureau of Standards, he said, to his knowledge, this was the first time the government had been brought in to have say on and provide feedback as a standard was being developed, and how important that was, and what a difference that would make. So Neville, speaking to your point, that is exactly right. If we can advocate to all these different countries to get on board now, to get buy-in so that we can hear their feedback, that really will make a big difference in the uptake. Sorry, I just wanted to add that. Okay, Sarah, back over to you.
Yeah, thanks, Diana. That's an excellent observation and excellent question. Neville, there's a couple of other questions that have come in for you in the chat. I'm gonna kind of group them. So one of the questions is from Adrian. It builds on the question that Diana was asking about involvement in advocacy related to the ISO standards. And Adrian is asking what your advice would be for individuals at the country level for getting involved in that ISO process. So how they could join into that process, and how that process might be different from what you experienced to set up the national standards in Kenya. So sort of how that advocacy approach might change if we're engaging ISO versus KEBS directly. So that's part one of the question I'm going to refer to you. And then the second part, which came in from Sophie, was a question about what types of arguments really resonated with KEBS and the other decision makers that you were working with in Kenya. So what were the main things that you were promoting in your talking points, sort of in your justification for your advocacy ask? What were the main things that were resonating with those decision makers? So back over to you, Neville.
Thank you. So maybe to start with the arguments that resonated with KEBS. So as I mentioned earlier, at that particular time, washable pads were fairly new. And no one knew, even KEBS mentioned that they never knew that they would get to a point that they develop standards for clothes used to manage menstruation. So one of the arguments that really resonated with Kenya Bureau of Standards was one, the need for them to look at it from the perspective of the user, the safety of the products vis-a-vis the users. We carried some of the products when we had the first engagement with the Kenya Bureau of Standards and took it to them. They were not the best of products by that particular time. And if by any chance anyone was to be harmed by those particular products, then it will raise the hue and cry across the country. So one of the things that really resonated with them was the fact that, one, there is need for safety, and also it's a public good. The link between that to the health of the users. Then also, secondly, another thing that really resonated with KEBS was looking at, we already had standards for single-use pads and no standards for washable pads. That will mean that we are not leveling the playing field. And at the same time, we had already had engagements with the Kenya Revenue Authority in terms of taxation and also introducing some of these products to them. And that is when they referred us to the Kenya Bureau of Standards, because they could not work on matters taxation without first recognition from the Kenya Bureau of Standards and also Ministry of Health. And that was the reason why we had to make it explicit in that particular policy. Then to Edian's question, initially when we were beginning this particular process, KEBS was, for lack of a better word, sort of an amorphous body that we never knew how to engage with. And also at that time, we also had a lot of heat within the country on some sugar imports. So everyone was very careful in terms of what is it that we are going to do. KEBS normally invites anyone who may want to join any subcommittee. I think it is towards October or November. They send out a request and people apply. And in most cases, the people who normally get that opportunity at times are the manufacturers of single-use pads who sit within these committees. So what we did when there was a window that they sent in those requests, we decided that we are also going to front some other people. For instance, Ministry of Health became explicit that has to sit in that committee, then also a representative from the MHM committee that we had. So based on that, or at least we are able to have two allies who are able to champion that. But also for those countries that will want to do to engage in this particular process, for me, I wouldn't want to go the KEBS way, but I would rather look at a mix of different actors who are able to bring different skill sets, because that is what also harmed us a bit. We needed someone from textile, we needed someone from who makes single-use pads and washable pads and others. Yeah.
Awesome. Thank you so much, Neville. So in the interest of time, we've got about 3 minutes left. I'm going to pose one final question to each of our speakers. If people have other questions that we either didn't get to that are already in the chat, I will pull those and make sure we circulate answers. But you are also welcome to reach out to speakers directly if you do have questions for them about anything they presented today. But the final question that we wanted to pose to each of you was that if you had one sort of key takeaway or final message that you want people to walk away with today about advocacy, about the importance of advocacy, the what and the how of advocacy, kind of what would be your main takeaway for people who joined us today as they go off into the world to continue their advocacy efforts? I'm going to give everyone just a second to reflect on that, but just to help you organize thoughts and responses on that, Beth, we'll hand it to you first. We'll then turn it over to Halima, and then Neville, we will close with you. So Beth, over to you. I know I'm putting you on the spot pretty quickly.
That's all right. My advice would be to do your research as much as you can about the landscape of the issue that you're trying to advocate for, and then find the easiest thing, the smallest thing that you can start with, the thing that you know you will succeed with, so that your coalition keeps coming together and that you have some opportunity to celebrate along the way.
Awesome. Excellent advice, Beth. Do your research and then focus on one accessible, easy, tangible win. It's great advice. Halima, I will hand it to you next. What would be your main takeaway for people today?
Main takeaway, building on what Beth said, you need to get that decision maker, the person who has the power to transform or to translate or to enable you to attain your objective, whether it's a policy objective or a funding objective. That one single person, understand that person well, because whatever you're going to be presenting to that person will depend on who or what is he or she made up of, you see? So I feel like that's where you should get that, and the timing, when are you going to be engaging the person? So know your decision maker well, otherwise you're going to hit off target every time.
Excellent. Thank you, Halima. A great takeaway, making sure that you have the right person in mind who can actually make the change or control that outcome. Last but not least, Neville, I will hand it over to you for one final takeaway for us today. Over to you, Neville.
For me, my advice would be advocacy might not be easy, but it pays off. So it's just a matter of being persistent. After you've known the right doors to knock, and also at the same time you've gotten to a point of what Halima has said, the next thing is just to remain persistent and do not give up. Yeah.
Awesome. Thank you so much, Neville. Yes, an important reminder. Advocacy, again, it's a process, right? It's something we have to keep coming back to. We have to persist through, but that those hard efforts really will pay off in the end goal that we're all trying to achieve together. So that brings us to time. I want to say a tremendous thank you to our speakers today, to Diana, to Beth, Halima, and Neville. I also want to thank the Africa Coalition for Menstrual Health for their partnership on this learning series. This does conclude our third and final part of the learning series. I put the links to the other two webinars in the chat if people are interested in checking those out. And we will send a final email to everybody with all three links from the learning series, as well as just relevant information, resources, and tools that were shared. So with that, a tremendous thank you. I know Diana, Beth, Halima, Neville, you four are such incredible advocates in the menstrual health space and then in the sexual and reproductive health space more broadly. So thank you all for sharing your time and insights with us. And thank you to all of our attendees for joining. Happy Menstrual Hygiene Day week and best of luck in continued advocacy efforts. Thank you so much, everybody.
Thank you,
Sarah, for all you
Thank you.
do.
Yeah.